Today I'm going to guide you through the controlled articular rotations for the hip. So let's go over each position and transition with standing hip cars. First position is to externally rotate the hip, and then the transition will lift up as high as we can with the hip externally rotated. Then we'll transition into position 2 by losing the external rotation and trying to drive the knee up higher in the hip flexion. Then we'll transition into position 3 by driving the knee out as far as we can. Then we'll internally rotate the hip while pushing the leg behind us to complete the standing hip cars. When performing your hip cars, be sure to do them slowly and focus on each position and transition when rotating the hip. Typically, transition 3 to 4 is the most difficult for the hip cars, so be sure to go slow as you internally rotate and push the leg behind you. Here's a side view for the hip cars. Notice as I drive the knee out and then start internal rotation, I keep my core tight so I don't drop into an excessive anterior pelvic tilt or lumbar extension. And always remember, when performing your cars, be sure to do them slowly, in control, and with intent. That way we can get the most out of the joint.